Hello, everyone, and welcome back to our next panel. Now, yesterday we talked extensively about the vaccination effort here in the U.S., but as we all know, this is a global pandemic that will require a concerted global effort to stamp out the virus, or at least learn to live with it in some form. So our panelists today each have a very unique perspective into how we can begin to tackle this once-in-a-century global pandemic. So I'll start with a brief introduction of everyone. We have Stewart Simonson, who is Assistant Director of the World Health Organization. Prior to joining the WHO, he was the first ever Assistant Secretary for Public Health Emergency Preparedness with the U.S. Health and Human Services Department, where he helped build up the agency's preparedness and response capabilities in the wake of 9/11. We also have Dr. David Fitter, who comes to us from the U.S. Centers for Disease Control and Prevention, where he serves as co-lead of the Vaccine Task Force. He previously served as CDC Country Director for Haiti and has worked extensively abroad in places such as Kenya, the Democratic Republic of Congo, and Syria. So we also have Rosemary Banks, who is the New Zealand's ambassador to the U.S., a 40-year veteran of the Foreign Service. Her previous postings include permanent representative to the UN in New York, ambassador to France and Portugal, and permanent representative to the OECD. And last but not least, we have Dr. Daniel Ober, who has been the medical officer and senior clinical executive supporting Cigna Global Benefits North America since 2010. He's been with the company since 2001, serving in a variety of roles. And before that, he was a professor at Dartmouth Medical College and also practiced family medicine, obstetrics, and hospice care in New Hampshire. So welcome, everyone. We have an incredibly diverse panel and a lot to cover. So I want to begin by mentioning kind of a big development in recent days, which was the announcement by President Biden that he would send 20 million doses of Pfizer, Moderna, and J&J vaccines to other countries. That's on top of a previous pledge to send 60 million doses of AstraZeneca abroad. It was a welcome announcement, but when it comes to global vaccine contributions, the numbers are pretty stark. We had a panelist yesterday, Apurva Mandavilli of the New York Times, who pointed out that only 0.3% of vaccines administered globally have gone to the 29 poorest countries, even though those are home to about 9% of the world's population. Now, to address this global vaccine divide, the WHO has established something called the ACT Accelerator, which brings together a variety of entities to fight COVID on multiple fronts. And within that framework is the vaccine component that many of us are familiar with, known as COVAX. Now, by the end of the year, COVAX is expected to have delivered roughly at least 1.3 billion vaccine doses to 92 lower income countries. And while that may sound like a lot, so far just 0.2% of people in lower income countries have had a vaccine, compared to about a third of people in wealthier countries. Experts also estimate we will need about 11 billion shots to vaccinate 70% of the world, with some poor countries potentially not being vaccinated until 2023 or even 2024. Now, I know I just spit out a lot of statistics and figures. I know I'm guilty of it all the time, but I really think it puts into sharp relief the inequity that we're seeing around the world. So, Stewart, I'd like to start with you because, a huge part of your portfolio is trying to tackle this inequity. What are your thoughts on the progress that COVAX has made so far? And, to put it bluntly, do you think wealthier countries are doing enough to help the developing world? And if not, what do you need them? What do you want to see them do more?
Well, thank you. I would say that, first of all, it is a breathtaking achievement to have just to have a vaccine at this point. I mean, think about it. 1.5 billion people have been vaccinated so far, or doses given so far. The first vaccine was listed for emergency use 1 year after the public health emergency of international concern was declared. When I worked in vaccine development at HHS, we thought if everything hit just right, it would be 4 years once a novel microbe emerged. So there have been tremendous achievements made thus far. But there's no question about it that COVAX is under-resourced, both financially and in terms of product. There isn't enough vaccine production capacity and expertise in the world to cover the 11 billion doses that you mentioned will be needed. I think it's something like 3.5 or 4 billion dose capacity in the world right now. So it was inevitable that there was going to be this inequity. But I do think there has been enormous generosity shown by wealthier countries to COVAX and to the ACT Accelerator. The United States has given an enormous amount of money. It's the #1 contributor to COVAX. And so I think there is a lot being done now. I would prefer to think about what we can learn from this today and apply it to what we know will happen, that there will be a much worse pandemic in the future. As bad as this is, it is not the 1918. And we must learn the lessons of COVID. And one lesson is there is insufficient vaccine production capacity and vaccine expertise in the world. We need more capacity on all continents. And we need the capacity to cover that 11 billion doses you mentioned. And we need to build a culture of immunization across the lifespan. Right now, it is mostly a pediatric culture for immunization. Adults get immunized in higher income countries, but not in low income countries. And we need to build that culture of immunization across the lifespan in all countries. So,
David, I think that's a good segue into some of what you do. I think that's a critical point that, we talked yesterday, we had a cardiology panel, diseases don't stop for other diseases. And as vital as vaccinating against COVID-19 is, it's just as important to continue immunization programs for conditions that, can often be deadlier than COVID-19 in many countries. So can you talk a bit about how you're working at the CDC to ensure that other immunizations continue, are maintained and possibly expanded? And can you give some of the examples of where you're working to do that?
Yeah, no, thank you. And first, thank you for having me. I think these kinds of panels are especially important to sort of get out the message and share information about what's going on across the gamut of activities. I think Stewart said it really well to sort of set the stage for this is, where are we? We have advanced sort of exponentially with regards to safe and effective vaccines and getting them out into populations. But also I think COVAX is extraordinarily important because we have to communicate across, a breadth of partners of who's doing what, where, and how. And I think, Anna, that's getting a little bit to your message, and also what Stewart was just saying is sort of twofold, if you'll allow me. One is that the immunization system needs to be supported for just routine activities in general for two reasons. One is to provide those routine services I think that Stewart was speaking of, and Anna, that you're getting at, and also to support rollout of a new vaccine. New vaccine introduction in countries is a difficult process. Even if you're a high income country, it takes time, it takes effort, and it takes resources away from sometimes that routine immunization system. So, CDC working with other USG partners, working with WHO and the international community also is trying to say what's going on to immunization systems across the world, and what can we do to continue to help support that. I think one of the stark pieces of information, and WHO collects this regularly, is that immunization campaigns have been interrupted in 49 countries. I think 59 large immunization campaigns have been interrupted. So that's millions, hundreds of millions of doses. I think measles is 126 million doses have been missed for routine immunization activities. And this affects populations, and we have to keep an eye on this while also keeping an eye on the pandemic that's happening. So we want to prevent other things, other outbreaks that are happening across the world. I think people were tracking the Ebola outbreaks that were occurring as well during this in DRC and also in West Africa. So CDC is working very hard with international partners, sort of on the global level, on the regional level, and also at the country level, to support those immunization systems that you were talking about, is bolstering, whether it's data management, training, workforce development as well, all the way down to micro planning, and doing this in partnership with groups like WHO, UNICEF, the countries themselves. Those are the main stakeholders. So we want to ensure that we are empowering them to protect their immunization systems, bolster their immunization systems, and also prepare for COVID vaccine as well as they begin to roll out further. So I could probably stand on my high horse for a while and speak about routine immunization activities and how so important they are. But I do appreciate you bringing that up, and I really appreciate everybody on this call's commitment to this as well.
Yeah. And no, I mean, it was, a lot of what we talked about yesterday, for instance, was how, cases of heart attack, of cancer, have risen just out of the fear here, even in, wealthier countries, of going to the doctor. So it's really a problem that's hit both the developed and developing world. So, Ambassador, I'd like to switch over to you. Now, obviously, when we hear of New Zealand during the pandemic, most people think of, a model of success. Your country has all but eliminated the virus, not necessarily through vaccines, but through, strict quarantines, aggressive testing, tracing, and other measures. The motto has really seemed to be go hard, go early. Now, obviously, the exact experience of New Zealand, a wealthy, geographically isolated island nation that was able to close its borders, can't necessarily be replicated in many other countries. But could you talk to us about some of the lessons that you have learned in fighting the virus that, can be applicable and helpful for other countries?
Well, thank you, Anna, and thank you for this opportunity. Well, as you say, we've all but eliminated, and we're proud of that achievement, but we're at the same time very humble because we do recognize that much of our advantage was geographic. However, I would also say, in terms of lessons that are applicable to other countries who aren't distant islands protected quite largely by that distance, that very early action was critical. And I think, we would say that clear leadership, constant communication to the public as to what we knew, what we didn't know. And we had, for many, many months, we had a daily media briefing that the Prime Minister and the Director General of Health gave, and that was available nationwide, and people really tuned into that. It's, I think, a comment that's made in the independent panel's report. It says that competence and leadership were more important than cash. So I think those sort of elements that perhaps in previous pandemics haven't been considered quite so crucial to managing the situation, of leadership, of trust in government, of reliance on science, of course, and strong and constant communication. I think those are certainly lessons that we've learned that we continue to apply, and that can be applied irrespective of the wealth of the particular country.
Mm-hmm. Yeah, and even on our initial panel today, we had Virginia's vaccine coordinator who stressed that there is no such thing as over communication during a pandemic, even if the messaging can be confusing. At the end of the day, transparency is so vital, and that goes across governments and across countries. Now, Dan, you bring a different perspective here, that of the private sector, which of course is just as instrumental in combating the pandemic on a global scale as the private sector is. We focused a lot in general on developing nations, but of course this pandemic hasn't spared any country. I mean, we've seen this here not only in the U.S. but also in other hotspots like Europe. So, given that your work has touched on a range of different countries, what have you seen over the last year and a half in places we haven't necessarily been talking about today? And what do you expect or at least hope to see moving forward as parts of the world transition into this new post-pandemic norm, if you will?
Well, thank you, Anna. And I'm impressed by the comments that were made earlier by the other panelists. It is amazing how many of our comments, when you think of them, are really interrelated, intertwined, and actually saying many of the same things, regardless of the particular constituency that we represent. Very good to see that. So Cigna is a global health company. We have a membership or customers or employees around the globe, our own employees, and then those that we take care of. Many of us think of Cigna as a private insurer, which we are, but we also a local insurer in many parts of the world. And we also have a large constituency that are government-based, as well as all of what we would call the globally mobile. So expatriates, people traveling, very unique issues related to them during this pandemic. While much of the world did maybe close down or at least contain its borders, there was still this globally mobile population, expats, business travelers that are critical in markets, impacts into the U.S. But as I take all of those, one of the things that we think about is how do we pull this all together, regardless of whether they're a private sector or not necessarily. Granted, our folks would be part of that private sector, but remember, they have families that are not. They may be part of an expatriate plan this year, but next year they're on local coverage in their local country. That could be any of the more remote countries that are further behind in the vaccine promotion and campaign and availability, or it could be one of the more advanced. A couple things that I would think about. I've been doing a lot of work recently in India, and a lot of people don't realize India, while it's India and we think of it as India over there, it has implications across the world. It is such a big producer of vaccine. So if it's not up and functioning, what's the downstream impact there? We also think of as recent as late last evening, now the implications outside of India. And using India just as an example, the most deaths recorded in a day, and recording we know can be a challenge, but those implications as you look at the countries surrounding India. So you think of Nepal, you think of even Afghanistan, Pakistan. These places are things we have to keep our eye on, regardless of whether you're in the private side or the public side. A couple other challenges that I'm seeing, given the breadth that we have across Central and South America. So Brazil is a real challenge. And then, of course, if you think into parts of Asia, Indonesia, for example, and then all across Africa, where we haven't seen excessive amounts of COVID disease per se, and there may be reasons for that. Maybe it's a younger population and there's disease but less symptomatic, and or we may be waiting. May have done a very good job to miss the first wave, but may get hit with the second wave. But aside from all of that, I think what's important is that we do partner and that we do take a real population approach. My constituent, my part of that might be the private side of it, but that has to be hand in hand with the public side of it. I heard very loud and clear from Stewart and David, and then even Ambassador Banks, that we have to take a broader 30,000 foot view, build a strategy that incorporates all of those pieces, integrates all of those pieces. The biggest one, and I don't care what market you're in, is this culture that's not fond of immunization. I'm impressed the way Stewart mentioned it, but we have it in the US, right? We have a lot of hesitancy. I'll just close with, I would also add, this is an event that's happened. Many people would have said it was potentially predictable, not COVID, but a pandemic of some sort. And what I would say is, let's not focus too much on what we should have done, could have done, but let's focus on what have we learned. Let's take those tough learnings, some of which our panelists have mentioned already. including things like politics and where we stumbled and what have you, and turn those around and say, okay, great opportunities to do something different the next time. Because there will be another event, and let's keep it at an epidemic or a local infectious process, and be one step ahead.
Right. Well, of course, it's always easy to be a Monday morning quarterback, or in my case, I don't know because I don't watch sports. But anyway, and so looking ahead, there's still so many issues that we're trying to work out. And I'm glad you mentioned India and the fact that beyond the crisis that's happening, India is a lot of people may not know, a huge vaccine producer. That has been exporting to other countries. And so I think this gets to another issue that's really being currently hotly debated at the WTO, which is the issue of patent rights. And Stewart, I want to turn this over to you. President Biden has expressed support for waiving intellectual property rights for these vaccines, something the pharmaceutical industry is against. But it's one step. I mean, it's debatable how much of that will actually translate on the ground into other countries being able to eventually develop their own or vaccines on their own. So, sir, can you talk a bit about what it would realistically take for countries to ramp up their own manufacturing? And, on the flip side, the pharmaceutical companies' arguments that it's actually more efficient for them to use already established manufacturing hubs to scale up production and then donate those doses?
Well, let me say first off that we need more, as I said at the outset, more production capacity around the world. But vaccines don't make themselves, and they are much harder to make than a drug. It is art and science, and so we need to build expertise and to focus on the tech transfer, not just the intellectual property rights. I think the president showed great leadership in coming out in favor of a TRIPS waiver, a narrowly tailored TRIPS waiver. Not since World War II has the world seen this level of disruption. And I wonder if we were in a conventional war right now, where the outcome depended on a TRIPS waiver, if we would be even having this argument. And the fact is that while it won't solve all of our problems, there is no silver bullet for all of this. It is a signal, and it is an important sign that we have to do more, and that the inequity that we are seeing is not sustainable. It isn't just about equity. The virus is egalitarian. It goes everywhere, and it flourishes where there is no vaccine. And so it is not in our interest here to not be vaccinating in Haiti or in the other countries, the 11 other countries, member states of WHO that haven't even begun vaccinating, because that's where the variants will come from. Mm-hmm. And so we have to be really mindful of that.
Now, Stewart, I just want to follow up on that. Of course, many of us understand that no one is really safe from COVID until everyone is safe from it. It is in our own self-interest to inoculate all parts of the world. But, theoretically that makes sense. But obviously in practice, it's a hard political case to make to leaders, and say, well, before you vaccinate your own people, send it off to this other country. And I know the WHO has recently expressed the hope that countries, instead of vaccinating their children, that have moved on to the stage of vaccinating children, will, consider more donating some of that surplus, so to speak, to help vaccinate, frontline healthcare workers in other countries. I mean, do you see this message resonating with governments, given that the public, it's hard. You want to vaccinate your own kid,
No, I understand. And I recognize that this is a politically charged issue. This is one reason I think what the president has done is so impressive to me. that he is sending vaccine offshore. And it shows real leadership. But I think I want to be forward-looking, and the answer really is not about bickering over the limited capacity that we have now. We have to focus on building capacity. And I have to say, this is not a newsflash. We have been talking about this in public health for decades, in the context of influenza in particular, which is mostly a higher income, upper middle income country phenomenon. You don't see influenza vaccination in lower middle income or low income countries. We know we need more vaccine production capacity, and we need more expertise, and that's what we ought to be focusing on.
Mm-hmm. So, David, I want to turn that over to you, and I know you've touched on this before, but the CDC is, again, it's not just about the vaccines. It's preparing countries for the vaccines. It's the expertise. It's the supply chain issues, storage issues. And you're already working in countries where they lack a lot of basic health services to begin with. So, can you just, expand on some of what the CDC is doing to strengthen this infrastructure, and maybe offer up some, specific examples of where you're working to do this?
No, absolutely. And maybe I'll pick up the baton from Stewart a little bit on this as well. And I think Daniel is getting at this. We know that we need to support countries around the world, not just from an ethically standpoint that this is the thing to do, but it protects our countries as well. And I think if you look at international health regulations or the global health security, these are the goals that we are pushing towards. And I think these are goals that we need to continue to reinforce, and that communities outside of just the health community also need to reinforce. So even if one looks at the global health security agenda, which sort of stood up following the West Africa Ebola outbreak, a lot of these topics were within that. And one of the big aspects was strengthening health systems. And maybe I'll put a little finer point, because this is what I do all day, but strengthening public health systems as well, and knowing the difference and asking the difference of what they are. So disease surveillance activities, preparedness and emergency response activities, public health labs. So not just the lab at the hospital that you go and you run your chemistries on, but public health labs that are supporting the whole country and supporting regions as well. And CDC does this, again, in collaboration with a lot of partners on this. And so then if we tailor this a little bit more towards the vaccine and COVID vaccine rolling out, this again goes to a system-based approach. And it seems like quite a mountain to climb. But I think if you start taking it in the pieces and you look at the system-based approaches and what CDC, USG, WHO, and a lot of other partners have already been putting into these systems with partnerships outside, again, of just public health. I think working with the diplomatic communities in a lot of these countries as well, and creating systems that are a little bit more resilient. So any outbreak or sort of natural disaster taxes a system, and we really don't want that system to break. As it gets pushed, as that pressure gets put on the system. And so that is putting into place these kinds of activities, building up public health capacity within human resources. That's maybe one of the biggest pieces. And I think Stewart was referring to that, and Daniel as well. And also I think Ambassador Banks in her comments. You have to have the people that are trained to do this work trained up, and that takes time. So investment in these countries, while it's extraordinarily supportive to do it during the outbreak, we really want to think before the outbreak so that they're trained appropriately so that they can respond appropriately. Mm-hmm. And not to beat a dead horse, but I do want to go back. These vaccination rollouts in the United States alone, I've spent the past several months doing it. It is a zero-sum game. And by that, I mean, if you're creating a separate immunization system to roll out really fast, that workforce comes from somewhere. And that workforce is pulled. And so you do want to make sure that your routine immunization systems or your other public health systems are still functioning. And I think that's one of the biggest pushes for CDC, is ensuring that we're training up workforces so that we have big workforce development programs. We're working with public health labs as well, the emergency response capacity in countries. So we want to really ensure that all of those pieces are in place. And if you'll allow me, one thing I want to hook on, and Ambassador Banks brought it up, was in regards to constant communication. And I'll go one level further, is about what are the types of communication. And I think one of the pieces is just ensuring that people know what's happening, that they get information. And this is helping combat mis and disinformation. So this infodemic that WHO is pushing, CDC is a really big part of this as well. But also, the diplomatic community, these are trusted communicators around the world, ensuring that they have the right information to share that with regards to risk communication and really the community engagement, because we want to get ahead of things. And this goes to demand, and you brought this up earlier. We want to get ahead of demand. We want to make sure that people understand what the vaccine is all about and what we're all trying to do.
Mm-hmm. I like that infodemic. I'm not gonna lie. I'm gonna borrow that phrase because it is in its own way a pandemic, a crisis. So, Ambassador, I want to turn it over to you because I know New Zealand is spearheading this regional approach to ensure that your Pacific Island neighbors are inoculated and again also trained to be inoculated. Can you talk more about that program?
Yes, indeed. I'm pleased to, because it does go back to the point made earlier about, the responsibility of governments to help others, even if they haven't actually finished their own population. And certainly Prime Minister Ardern is very, very much aware of the inequities that have been shown up by the pandemic and the need to reach out across borders. So in New Zealand, we have already started a program of providing vaccines out to the Polynesian Pacific Islands. We've also, the Prime Minister announced just last month at a COVAX meeting that we would also do dose sharing in the sense that we would make available for reallocation the 1.6 million doses that we would have been allocated under self-funding arrangements from COVAX to make those doses available to countries in greater need. In the Pacific, we've also put about close to $50 million US into supporting health systems, and that's the full panoply, training the people to administer vaccines, dealing with disinformation, and providing the actual materials. So we're very conscious of our responsibilities in the Pacific, and of course not only, as again was acknowledged earlier, not only from an ethical and a kind of a partnership or a moral standpoint, but a very practical one, because most of the air routes into the Pacific either go through New Zealand, many of them, and some through Australia. Of course, there are other connections, but we're very conscious that we both need to protect the Pacific from infection coming from New Zealand, but also protect it longer term by making those vaccines available.
Mm-hmm. Now, I wanted to actually follow up, something New Zealand did was, close its borders, and now is, there's talk of travel bubbles and things, and the world is gradually opening back up to travel, but is trying to consider how to reshape it. Now, the big news is that the EU will begin accepting leisure travelers, non-essential business travelers over the summer to its member states. And, we are in this debate about a vaccine passport, and it's obviously not going to be one global passport. But given, New Zealand has a huge tourism industry, this economically has been difficult for your country. What are your government's thoughts on, a possible eventual kind of vaccine verification system for travelers?
I think all of those points are under constant consideration, Anna. We've opened up a travel-free arrangement with Australia just about less than a month ago, and this very week on Monday we opened up with Cook Islands, which is constitutionally part of New Zealand, but nonetheless it's always been a good tourist destination. It's definitely been very, very painful for our tourist industry. In fact, that's been as much of a contributor to GDP as our dairy industry. So there's a very strong impulse to get our borders open again, to be able to welcome tourists back. I can't predict what the government will do in terms of how and when, but I do know that the question of managing the border and getting ourselves globally connected, as we've always been very, very proud of being, is a top priority.
Mm-hmm. Now, Dan, a lot of your work, obviously, over the last year and a half has been immediate responses to the pandemic. As you said, helping expatriates. You've worked with governments to help, on the military side and so forth. But moving ahead, what as a global health services company are you anticipating in terms of issues coming up where, even though we're moving to a new normal, we're still going to have, trauma from this, and just our lives will fundamentally be reshaped. What kind of issues are you anticipating? For instance, yesterday we had a mental health panel, so obviously that's going to be a big issue, how to get over the anxiety. What are some of the things you are keeping an eye on for in the months and even years to come?
Yeah, it's a very good question, because behind the drama of the acute event, I think we're all sensitive to what else is going on. A couple of things that come to mind immediately. Number one, there was and has been a mental health pandemic, in quotes, for years, exacerbated dramatically by COVID. Whether that be the individuals in a post-COVID potentially central nervous system effects that we've seen some literature on, but also as it affects our family friends, especially when they're from away and we can't really see what's going on. I'm seeing oftentimes my customers and clients will refer to it as intense worry and anxiety, but I think it gets deeper than that. It gets to a disparity. There's comments about loneliness and how that really impacts people. It's not just loneliness anymore, a little thing. It's really had an impact on the world. Those mental health impacts. And we think of a younger generation who's growing up and has now spent a year with this in critical points in their life. What does that mean to them longer term? But I will say that people are resilient. And I will say that if we continue to help people, they will learn to cope. They will learn to take their adversity and deal with it in a way to hopefully make it a strength. But that's going to take resources, time, energy, and support across all industries, both the home, the marketplace, and obviously payer source and so forth. Access to healthcare, to mental health care has been a barrier in parts of the world where mental health is still a taboo that's significant. The other thing I would think about is we have continued. It's interesting in my world. I'm amazed at how many people are still traveling, not necessarily for fun. Although there are people that have had opportunities to travel because it's been the right price and the right time. But I have seen people that have had to travel. It's a fact of their life and their livelihood. And that is quite complicated today. Can they get back home? In fact, if they do have, in my world, daily, I'm handling what we call emergency situations where people have an emergency life-threatening event, and we need to move them out of an area, potentially an area where they cannot get care. They don't have the quality or the availability of care, but they may also have wonderful historical care, but they're overloaded. They're overwhelmed with what's going on. India, and I've seen this in UK, I've seen this in different parts of the world, and how complicated it is now to move them around the globe. For border area issues that we talked about just previously. I do think we're going to have some sort of documentation. We hear about passports, but I think it'll look very different than it does in the initial thoughts of what that would be. But we have some of that today. So we have for yellow fever and documentation if you're going to an area. So we should take advantage and look at what isn't really new and how do we maximize that? How do we benefit that? Helping people, helping governments to see that perhaps we don't have to reinvent the wheel, and then partner to do it. I've also deal with a large group of what people might forget is international travelers called students that travel around the world. It is so important to their growth and development in a global economy. I have two teenagers, one in college, and the big issue is global learning in a global world and how that impacts their ability to get back to some global interaction and really promote a global world and a global economy and not see it just through the lens of my little town, my little piece of the world. And I think we're all saying that. So those are really the areas that we're looking at. How do we expand upon that as we move into this new world? vaccines are a very important part. They're only part of the solution. Hygiene, hand washing, masking, still very important. Messaging has to be very important as you deal with people with fears. Consistent messaging. At Cigna, we typically lean towards what's out there in the public realm. So things from the WHO, things from the CDC, local CDCs and health ministries, so that it doesn't sound like, while we believe we're saying the same thing, the audience might think we're hearing something very different and therefore get confused. So when you pull all those together, I think that's the way that we're looking at it. Opening up will be gradual. Opening up will have different drivers. It may be tourist industry. We need it. The fact is we need it for the economy to sustain. Yet in other parts of the world, it may be for a different reason. Safety, security even. So as we move through that, I think the role that we all have, including on the private side, is how do we partner again to open that up, to move forward, but essentially be swimming in the same lane, to be singing the same song, to be giving the same message to people so that they're not confused. My home country's telling me I'm free to travel, but I'm an international travel, and your country's telling me I'm not. That's very difficult for people to understand. So bringing that all together, almost like an orchestrated, like instruments playing together, that ultimately there's a common message, albeit variable based on the specific need, situation, location, and driving forces.
Mm-hmm. Well, they're all excellent points, and it reinforces the notion where every culture, country, locality has had its own individual nuanced challenges, but we're all universally impacted, and that impact is we're all interconnected by this pandemic and the long-term effects that we're going to see, whether it's education, and so forth. This is going to leave an indelible mark on everyone in all parts of the globe. And as you mentioned, every panelist here has talked about kind of the lessons learned. So I want to wrap it up, Stewart, with you, because their independent high-level panel commissioned by the WHO, came up with its conclusions recently. The main one being that it found that the pandemic was a preventable disaster if the world had reacted more quickly. It said that preparation was inconsistent, underfunded, the alert system was too slow, the WHO itself was underpowered, and of course it echoed the sentiment that this exacerbated inequalities. A lot of this isn't necessarily new. I mean, Dan talked about, a lot of the lessons we've learned are not necessarily new lessons. They're things, that are in place already that we just kind of need to act on. But obviously the key takeaway here was the lack of preparedness. Now, it's not your first rodeo dealing with preparing for public health emergencies, whether it's bioterrorism, Hurricane Katrina. You worked on this a lot in the U.S. So, two questions. Comment on the report and this issue. Are you optimistic that we will take these lessons learned to heart to prepare for the next pandemic? Or, you're in this business a long time. Does the attention and the manpower wane once the, immediate crisis subsides?
So I think there was, to my way of thinking, very little that was new in the IPPR report, very little that was new in the Global Preparedness Monitoring Board report. In fact, these are things that have been known and talked about for a long time. In fact, that's what it's been, a lot of talk, a lot of rhetoric, but not as much commitment in terms of resourcing and building what we know we need. Now, I mentioned earlier vaccine production capacity and expertise, but just as vaccines don't make themselves, they don't administer themselves. We need health systems. We need public health systems in countries, not just because it is the right thing to do, not just because we don't think people should, in the 21st century, not go to a hospital because they're afraid of financial ruin, but because it is in our interest. It is the astute clinician who will pick up the herald cases of the next pandemic. And we want these health systems to be there to receive it. So I think picking up on what David said, we've got to really think about these systems, public health systems, and primary health and healthcare systems around the world. It shouldn't just be a high income or upper middle income or lower middle income country phenomenon. It should be for everyone because it is in all of our interests.
Right.
Now, I think that is really important, and I actually am optimistic that there will be a change. As I said, this is different. It's different than some of the things that we have contended with before. I was involved in the H5N1 influenza planning process and the preparedness work, and that was a relatively small event, thank God. But this is different. As I said, not since World War II have we seen this sort of disruption. And I think leaders now have come to the conclusion that something has to be done. We'll know soon enough, and we'll follow the resourcing, because that shows you whether there is commitment. If there isn't a renewed commitment to universal health care, and if we aren't really building up vaccine production capacity and expertise, then we'll know. Mm-hmm. But I'm cautiously optimistic about that.
Yeah.
I think from my time at HHS, what I would tell you is that in an emergency, you pretty much have what you have on the day it started. It's very hard to innovate in the middle of an emergency. That's one of the reasons, one of the miracles, I think, of this time. I mean, there was a lot of innovation in the middle of this, right? And COVAX and the ACT Accelerator are innovations. But I think the suite of these things that can be done in the middle of an emergency are few. And so we have to think about things now and invest now for what we know is coming.
Mm-hmm. No, and I think that ends it on a good point of, and you mentioned this also at the start, of we cannot lose sight of what we have achieved. And it really is, I know that it's the cliche term unprecedented, but it is unprecedented. Dan, you talked about the resilience. We've talked about the global coordination that is taking place. COVAX itself is such a huge innovation. And the vaccines, I mean, granted, they are all part of this system that we need, but, they've been developed with a speed and efficacy that we have not seen in medical histories. And so, I hope that does lend a sense of optimism of where the entire world can go. And,
May I add one thing, Anna?
Please.
I want to also underscore something the ambassador said about communications and truthful information going to the public. This was really one of the lessons, one of the overarching lessons from the 1918 influenza, that it was about communications, about leadership, about telling the truth. And there's a very famous story of Philadelphia and St. Louis. In one place there was influenza denial, and another place they met it head on, and they treated the public as adults and they told them what they knew. That place did very well relative to the other place. So we know this, and that has to be one of the lessons that comes out of this too. Yet, I'm afraid we're in the middle of a war on science and a war on immunization in some quarters. And so I may not be quite so optimistic about that, because we've really got to take that head on.
Yeah. And, I mentioned the 1918 pandemic yesterday, and it is just amazing how the same lessons there of, as you said, communication, transparency, the measures that we know that are basic but that work, hygiene, distancing, quarantines, you saw that viscerally work in two different cities during the pandemic. And here we are 100 years later, in a sense, grappling with the same thing and, the same measures for all of our medical advances. And they are impressive. we still need to master the basics. And hopefully we will do that. And I want to thank everyone. I think we all had some really interesting insights, on the past and moving forward. I would like to remind the audience that you can take a break. We'll have a networking break. You can visit the expo booth for some more information. You can go to the networking function, just click the button. In our new virtual world, it's, speed business networking. You've got 3 minutes. You can extend your time and, get to know some of the participants behind the computer screens. So another aspect of our pandemic, but, a reflection of the ingenuity it has kind of created. So please do that. And then we will have our final panel, which kind of also has a frontline perspective that a lot of people might not think of, which is the embassy perspective. We have two high-ranking diplomats from the Embassy of the United Emirates and the Embassy of Brazil, so obviously dealing with the pandemic and talking about their experiences contending with the pandemic while doing their traditional role of trying to expand healthcare partnerships with the U.S. So kind of a twofold challenge for them. So again, please stay tuned, avail yourselves of the networking and the expo booths. And in the meantime, thank you everybody for all of
Thank you, Anna.
And joining.
Thanks for including me.
Thank you.
Thank you.
Yeah.
Be well.
Me too.